Training on devices. Read the RFID tag on the terminal screen. If the login has been done on the info kiosk, the program will automatically appear. If the login has not been done on the info kiosk, the program needs to be chosen from the terminal screen to be able to start exercising. Adjust the settings of the devices according to the displayed values. Choose the correct weight from the weight stack, and depending on device, do some manual adjustments. Manual adjustments are marked with yellow color. An example of this is upper back support in back extension device, which in this customer needs to be set to number 1. The system remembers the seat and footplate setup, which are done when patient enters the devices the first time. Adjust the white line in parallel with the yellow arrow. This is done with the range of motion adjustment. This indicates the correct starting position. After preparation, you can start training at any moment, and the system will automatically sense the movement after the second repetition. Note that in cervical rotation and cervical extension, the program needs to be started by pressing the Start Exercise button if the allowed range of motion is very small. When exercising, try to keep the movement limiter between the green markers. This means that you are following the correct exercise range of motion. On the right side of the screen, the correct training speed is displayed with the white horizontal line. The color under the white line changes according to the speed. Green means that the speed is correct and the color bar follows closely the white line. Yellow indicates that the speed is approaching too slow or too fast. Red can either mean too slow or too fast. The text itself indicates whether to go faster or to slow down. The system will count the repetitions from top down and indicate when the training is complete. You can stop at any moment and the system will go to results screen automatically after 4 seconds of inactivity, or you can switch the screen immediately by pressing the Finish Exercise button. The results screen shows facts about your exercise: the total training time of the set, the amount of work you did, indicated in joules, number of repetitions of the performed set, and quality of your training as compliance. The compliance is calculated from the set duration or the repetition duration, depending which one is used in the default program template, range of motion, and completed repetitions. The compliance is excellent if it is 75% or over. This is indicated in green color. 50 to 75% describes a medium compliance, and it is indicated in yellow. If the compliance is in yellow zone, attention should be paid in exercise technique. 0 to 50% means that the compliance is low. This means that you should pay extra attention to exercise technique and monitor if the patient is training, for example, with 2 big weights or range of motion. The motion gauge shows the ranges of the movements. Color codes indicate the speed. White is ideal speed, yellow is too slow, and red is too fast. You can also observe which repetitions have gone over the range of motion limits and which have stayed under. You can report the stressfulness of the exercise by pressing the appropriate button. After the set, you can do an extra set by just starting the movement or by pressing the extra set button. After the exercise, by pressing Proceed to Next Machine, the system logs you out. You can also log out by pressing the Logout button, which is the human figure on the top right corner. Modifying exercise program on device screen. It should be noted that the following modifications are meant to be done by an instructor. The idea is that individual modifications can be done directly from the terminal screen while observing how the patient does the movement. Through these tools, you may instantly react to any increased pain sensations, what the patient may feel, or to any compensated movements what the patient may do. After patient reads their RFID tag on the terminal screen, read your instruction card. Your name will appear on the screen. Terminal screen has a touchscreen functionality, and you may alter the following variables: repetitions, repetition duration, range of motion by sliding the green bars to a desired degree, and weight stack. In addition, you may change the seat settings. An alternative to the above-mentioned way of altering variables is Auto-Adjustment button. Auto-Adjustment button appears when instruction card has been read and the patient has started exercising. By pressing it, range of motion and speed buttons appear. They may be adjusted together or separately. The adjustment happens when choosing the desired variable button and continuing to do the repetitions. After 3 repetitions, the program recognizes the new speed or range of motion. It should be noted that you need to manually and/or verbally guide the patient towards the new range of motion or speed.